my name's Damian Green. I'm the Deputy Director General of eHealth Queensland, and I'm also a board member or director on the board of the Gold Coast Primary Health Network, as well as being a privilege of a board member of the Australasian Institute of Digital Health. And another one is an adjunct professor at Griffith University, particularly in relation to the connection of business strategy and innovation. And I've been in the role since 2019, late September, and I joined having great aspirations in my role, and along came COVID. And so it's been a really fascinating period to pilot such a large enterprise in healthcare through the pandemic. So my keynote this year really builds on my previous keynote in the last summit that we had in relation to bringing an interconnected healthcare ecosystem to life. In the 12 months since we've been together, healthcare in Australia has experienced unprecedented challenges. The pandemic continues, rising demand continues. We have the fallout and the tail coming of what happened to people's care, which was disrupted by COVID, and increasingly the challenge of dealing with comorbidities and rising chronic disease in the community. But we've also seen some massive changes occur in the last 12 months, particularly in terms of as jurisdictions have confronted the rising demand and the increasing need for healthcare, but also rising cost. And health systems have been confronted with the challenge of how do you deal with that? How do you manage the challenges of sustainability and meet that change? And the conversation really builds on last year's one around recognising that health systems like Queensland Health need to operate as part of a connected, broader system with our primary care partners, with other partners in acute care, but also build on the work we've done to create new models of care with those partners. And that's where we want to begin to introduce the concepts of what we're doing in virtual care, particularly around establishing virtual hospitals in Queensland, the role of a digital front door, and what opportunities that creates for us in terms of providing consumers enormous opportunities to get involved in managing their health and well-being and working alongside the Queensland Health and our partners, as well as talk about some of the new innovations that are coming in individual models of care that have been piloted in hospital and health services with digital technology. So if you're a digital health professional and you're interested in that interconnection between the business agenda, business strategy, and digital agenda, and how digital agenda needs to enable the business strategy, then you'll want to attend my presentation in that context. Digital transformation isn't about incremental changes to healthcare. Digital transformation is about making fundamental changes to healthcare operating model, either to drive efficiency or to improve the consumer experience, or do both. And I'll talk about that connection of digital strategy and business strategy and the pathway that we can take to enable it and bring it to life. So in 2022, we're setting a very ambitious program of work despite the challenges of COVID. So we've made so much success in terms of bringing the digital agenda to life through COVID, and obviously we've learned a lot. And so we're looking on our experiences, particularly in all the work we've done to scale virtual care across Queensland Health, the work we've done with our clinicians to rapidly adopt digital technologies in mainstream healthcare. We don't want any of that to go away. In fact, we want to build on it. So our 22 is about really mainstreaming digital healthcare delivery as the way of doing healthcare. So that's number one. And the second priority for us is to ensure that we're creating those partnerships with providers that we work alongside, whether it be general practice or other private providers or other providers who provide subacute care to ensure that we're delivering an integrated healthcare response. And obviously, we want to use 2022 as the year where we're leveraging the skills and capabilities of all parts of the sector to provide better care, interconnected care to consumers who use Queensland Health Services. Some of the specific initiatives on our horizon: the introduction of satellite hospitals, which provide the link between primary care, subacute care and acute care, and ensure that we're providing that better interface with consumers. Our plans around the South East Queensland Virtual Hospital, which is well in development and we're looking to bring to life in the forthcoming year, and our new plans around the digital front door for Queensland Health, which will provide a range of services, direct frontline services, not only to consumers, but also to clinicians who interact regularly with Queensland, whether they be part of Queensland Health or they be in the broader ecosystem.